Sedatives and the hypnotics. What are the sedatives and the hypnotic drugs? Sedatives are the drugs which reduces the excitement of the person and calms down the person. What are hypnotics? Hypnotics are the drugs that produces the sleep and gives a normal sleep to the person. Remember these two drugs, sedatives and the hypnotics. Now, which are the type of sleep disorders and their treatment? First, insomnia. Insomnia means lack of sleep. Hypersomnia means narcolepsy, always sleeping, daytime, night time, every time. Nocturnal enuresis. What is nocturnal enuresis? Means bedwetting, mostly seen in the child, means having a loss of the bladder control. And which are the drugs which we use in the treatment of these disorders? First, insomnia. Insomnia, we will give the sedative and the hypnotic drugs. In hypersomnia, we will give them amphetamine. Which drug? Amphetamine. And nocturnal enuresis. Nocturnal enuresis, we will give tricyclic antidepressant drugs. Now, what are the classification of the sedatives and the hypnotics? Classification include three main categories: benzodiazepines, barbiturates, and non-benzodiazepine. First, benzodiazepines. They are having a benzene ring fused with diazepine ring. Remember, split the word benzodiazepine. Benzene ring fused with diazepine ring. Okay. Now, what are the drugs in it? They are mainly having diazepam, oxazepam, lorazepam, flurazepam, nitrazepam, tempazepam, clonazepam. Remember, PAM. The last word is PAM. Okay. Now, what are the barbiturates? They are the derivative of the barbituric acid. There are also mainly three types: long acting, short acting, and ultra short acting. Long acting we include phenobarbital, short acting pentobarbital, and ultra short acting thiopental. Remember the last word ton in the barbiturates. Non-benzodiazepines, they are less effective than the benzodiazepines, but includes two drugs, zopiclone and azopiclone. Clone. Remember the last word, clone. Now, the type of sleep disorders and their treatment. Insomnia, all know lack of sleep. You can see in the picture the person having a lack of sleep. Which treatment should you give? You will give him sedatives and the hypnotics. Okay. Now, a patient with hypersomnia, the narcolepsy, you can see. Which treatment should you give? You should give him amphetamine. Remember. Now, the patient with nocturnal enuresis, majority seen in the child. We also call it as a bedwetting. Which drug should you give in it? We should give tricyclic antidepressants. Remember, tricyclic antidepressant. You may note about it.